Afternoon et bon après-midi à tous. My name is Catherine and I'll be your moderator today. Je m'appelle Catherine et je vais être votre modératrice aujourd'hui. Thank you for joining us for today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we begin, a few friendly reminders. Please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery, and that button is located on the top right corner of your Zoom video screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Veuillez aussi changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de la portion de votre écran. Reporters with accessibility needs can pin the interpreter Annette or follow along on the YouTube screen. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler l'interprète Marie-Jacques ou suivre la diffusion en direct sur YouTube. Today, we will be hearing remarks from Dr. Vera Etches, Ottawa's Medical Officer of Health, as well as Dr. Lindy Sampson, Chief of Staff from CHIO, and Dr. Stéphane Roux, Chief of Staff from Montfort Hospital, will be joining for the question period. Nos porte-paroles aujourd'hui sont la Dr. Vera Etches, médecin-chef en santé publique, ainsi que la Dr. Lindy Sampson, médecin-chef de CHIO, et le Dr. Stéphane Roux, médecin-chef de l'hôpital Montfort, seront aussi disponibles pour répondre aux questions. Following the remarks, we will take questions from the media. Je passe maintenant la parole à la Dr. Etches. Please go ahead, Dr. Etches.
Thank you. Bonjour. Good afternoon. I do want to thank our hospital partners for being with us today to share this important message. Je tiens à remercier nos partenaires hospitaliers de s'être joints à nous aujourd'hui pour partager cet important message. My counterparts in healthcare are people who have been on the front lines of the pandemic for 13 months. And while hospital staff are resilient and resourceful and brave, they are also human. They're exhausted, and we share the responsibility as a community to support one another, to reduce the pressure on our healthcare system and keep it functioning for all of us when we need it. Ottawa Public Health continues to report daily new numbers in the triple digits when it comes to people testing positive for COVID-19. 117 today, 112 yesterday, 184 Monday. And when you look back, the the daily total actually reached 226 on the 28th of March, higher than it's ever been. The rate has doubled in the last 2 weeks since we moved into the red control zone of the provincial framework. So that move has not turned the curve. The rate of COVID now is per 100,000 people is 85. The reproductive number is 1.2 and our percent positivity is 5. These are all well above the threshold for red control and they're increasing. So as our hospital partners will likely tell you today, hospitalizations are once again on the rise, as are the number of people in the intensive care units. Our healthcare system is stretched. Cases are rising, hospitalizations are increasing, the testing centers are maxed out, and our case management team is no longer able to contact trace as we have through previous resurgences. We're currently seeing an average of 4 high-risk contacts per individual who test positive. So with 117 new positive test results today, that means almost 500 high-risk contacts today alone. So Ottawa Public Health will continue to follow up with individuals who test positive for COVID-19, but we'll be asking them to help us to be responsible to notify their close contacts in many situations. The places where COVID spreads the most continue to be in private gatherings, such as parties, barbecues, after work get-togethers, team sports, and even outdoors. We see transmission. And these are where public health measures like physical distancing and mask wearing are not followed. So the variants of concern are taking over in the wastewater. This is happening very quickly, having grown from just 10% on March 20th to 50% of all the COVID detected on March 25th. This demonstrates their higher rate of transmission compared to non-variant of concern COVID types. While we're seeing transmission across all age groups, the majority is still occurring in the 20 to 39-year-old age group. And this age group will not be protected by vaccine for months. Younger people do show up in hospital, and unfortunately, earlier this week, someone in their 40s died with COVID-19. So this needs to be very clear. COVID-19 affects all of us. This virus doesn't discriminate. Cela doit être très clair. La COVID-19 nous touche tous, et ce virus ne fait pas de discrimination. So while Ottawa Public Health and our partners are focused on working in areas with higher rates of COVID, we're working to reach young people. The virus is present in all types of settings across the city. COVID-19 is everywhere. And it's hard to live this way. Sometimes we need that relaxation to feel safer with close friends and family. We might be wrongfully equating that not wearing a mask is trusting one another in those settings. But some people, maybe they're still observing a bubble with others, but with variants of concern and asymptomatic transmission and numbers as high as they are, now is not the time to let our guard down around others, even when we have that sense that it's okay with our close friends. We need to protect each other and limit our close contacts to our immediate household. The other visiting must be with distance. So we've always said that our individual actions matter. We've encouraged residents to be vigilant, to check our blind spots and adjust our behaviors. And for so long, people are working at this. So to call this current situation disheartening after all the work that residents have put in would be a gross understatement. We are seeing what we feared. The vaccine hasn't arrived in time to outpace the growth of COVID in our community. We are at a point that we've never seen before in this pandemic. Nous voyons ce que nous craignions. Le vaccin n'est pas arrivé à temps pour surpasser la croissance de la COVID-19 dans la communauté. If we don't get levels of COVID-19 back under control, we will see stronger lockdowns, like we've seen in other countries around the world, and for longer. We'll see more businesses suffer, and we'll see our healthcare system once again become overwhelmed. We'll see people in hospital hallways on stretchers. Healthcare workers won't be able to come into work because their children are waiting for a COVID test result. We're already tapping into an exhausted healthcare worker sector, and we only have so many trained staff available to test, to contact trace, to vaccinate, and to treat. We need them for more than just COVID, and they're tired. We're all tired. So in addition to our own individual behaviors, further restrictions are needed in our city to manage the situation. These discussions are currently underway. En plus de nos propres comportements individuels, d'autres restrictions sont nécessaires dans notre ville pour gérer la situation, et ces discussions sont en cours. Until enough of the population is protected, and this will take months, we need to do more to stop the spread of COVID. We've got to take a pause on indoor gatherings and dining indoors with people outside of our household. We need to take a pause on outdoor gatherings where people are coming into close contact with others, such as barbecues and contact sports. This weekend is the Easter long weekend, and other significant holidays are coming up. Do not gather with people you don't live with, except for if they are essential caregivers or if you live alone and you need that connection with another household. Do not gather with friends or extended family indoors. Do not share meals. Do find other ways to celebrate. The signs that spring are, is coming and they're starting to show, but do get outside, keeping in mind where you still come into close contact, that basketball, that soccer game with a more transmissible variant, it is still a risk. Please understand that the risk is not removed entirely outdoors. We've seen transmission at barbecues and at bonfires. So Ottawa, we will see this through. I'm optimistic about what the summer will bring, but we aren't there yet. We just aren't there yet. Nous y sommes pas encore. So the higher rate of COVID in the community now, the longer it will take for the vaccines to make an impact. And for the next few months, we need to keep up these measures while we vaccinate as many people as we can with each vaccine that comes. Merci, thank you, Miigwech.
Thank you, Dr. Mise. I will now invite each media agency in reverse alphabetical order today to ask their question. Please remember you have one question and one follow-up. You are also welcome to turn on your video function as well so that our speakers can see your lovely faces. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inversé aujourd'hui. Chacun pourra poser une question et une question de suivi. Vous êtes aussi les bienvenus d'activer vos caméras pour adresser les porte-paroles parce que ça fait trop longtemps sans voir vos beaux visages. We will now start. On commence tout de suite avec TVA Gatineau, Ottawa. Catherine Fortin, c'est à vous.
Oui, est-ce que vous m'entendez?
On vous entend parfaitement.
Oui, bien, en fait, ma question, c'est hier, François Legault a parlé d'arrimer les mesures entre Ottawa et Gatineau. Est-ce que c'est quelque chose qui est dans les discussions, comme les deux régions sont une à côté de l'autre?
Nous sommes dans les discussions régulièrement avec mes collègues en santé publique à Outaouais, Dr. Brigitte Pinard. Nous partageons l'inquiétude avec le taux de COVID-19. Alors, on veut essayer d'avoir plus de protection dans les deux côtés de la rivière. Mais c'est toujours une décision provinciale, les deux côtés, exactement les couleurs, les mesures. Mais à la base, notre avis, c'est le même. Dr. Pinard et moi, on veut avoir une situation où les gens n'acceptent pas des visiteurs dans leur foyer et les gens éviter le contact étroit avec les gens dehors leur foyer. Ça, c'est les mesures qu'on peut faire. c'est dans notre contrôle. N'importe quoi, les restrictions provinciales. C'est un point. Mais aussi, je pense c'est important si Ottawa a des restaurants ouverts et fermés, c'est différent à Outaouais, les restaurants, par exemple, un exemple, sont ouverts ou fermés. Ça crée des difficultés parce que nous sommes une région. On habite deux côtés, voyage à deux côtés pour travail. Alors, on a l'intérêt d'avoir une approche similaire et c'est une discussion qui continue avec les deux provinces.
Ben, merci à vous.
Merci.
Merci. La prochaine question sera de Radio-Canada. Antoine Trépanier, la parole est à vous.
Oui, bonjour, Dr. Etches. Je voudrais savoir, est-ce que vous recommandez au gouvernement provincial de tourner en zone grise aujourd'hui?
Oui, j'ai demandé à le médecin-chef en santé publique pour Ontario d'avoir le niveau gris à Ottawa cette semaine avant la fin de semaine. C'est un espoir que le gouvernement provincial peut faire cette action rapidement, mais ce n'est pas ma décision en fait. C'est clair pour moi que les restrictions dans la zone rouge n'aident pas maintenant, ou peut-être ils aident, mais pas assez de diminuer l'augmentation dans la COVID-19 dans notre communauté. Nous ne sommes pas au point où c'est correct de laisser COVID aller augmenter, d'être transmissible partout parce qu'il y a une population sans immunité et il y a des gens plus âgés qui ont besoin de la protection de le vaccin encore et il y a des gens moins âgés aussi qui peuvent avoir une infection sérieuse. C'est trop important. Les vies sont trop importantes de juste laisser la situation aller. Et nous sommes trop proches. C'est pas pour toujours. On peut voir une journée pas trop loin d'ici où on a la protection de la vaccin. Alors, c'est juste important pour cette période de continuer avec la protection.
Très bien, merci. Je voudrais peut-être faire un suivi sur la situation dans les hôpitaux, dans les urgences. On est à quel point exactement? Vous avez dit que l'élastique est étiré en ce moment, mais c'est quoi exactement la situation sur le terrain et est-ce que la situation est aujourd'hui critique?
Oui, bonjour, je suis le Dr Stéphane Roux, le médecin-chef de l'hôpital Montfort. Je peux répondre un peu à cette question-là concernant Montfort particulièrement, mais effectivement, la situation est très critique actuellement, en ce sens où les volumes ont recommencé, la population a besoin de soins et les hôpitaux sont pleins. On est à capacité actuellement, donc c'est ce qui est inquiétant pour nous, c'est de voir les projections qui ne sont pas très heureuses en ce moment. S'ils devaient se matérialiser, on aurait beaucoup de problèmes au niveau des hôpitaux pour cette capacité-là. Donc, c'est pour ça qu'on salue l'initiative de Dr. Etches de demander plus de restrictions en ce moment parce qu'on sent que c'est tout le monde ensemble, chaque petit geste compte. Et puis, le personnel des hôpitaux qui subit aussi les effets de la pandémie, des isolations qu'on doit faire. On a besoin du support de tout le monde pour nous aider à pouvoir vous soigner convenablement.
Merci.
Merci beaucoup. Our next question will be from the Ottawa Sun, Elizabeth Payne. Please go ahead.
Hi, thank you. My first question is for Dr. Etches. The head of the Heart Institute has called for patient-facing health workers to get a second dose of vaccine quickly as opposed to 4 months later. There's outbreaks there, as you know, and where 100% of staff have had at least one dose. How do you feel? Can you respond to that plea? And is that a point you're also making to the province?
I do understand the desire to have healthcare workers protected with COVID vaccine as much as possible. I want to reassure people that one dose of COVID vaccine does provide good protection. And it's currently something that is still being studied. We'll learn more about the best timing for the 2 doses. The National Advisory Committee on Immunization has looked at the best way to use vaccines at this point, and they'll continue to update their recommendations. We're following the National Advisory Committee immunization science that indicates when we're facing a shortage of supply of vaccine, which we are, absolutely, that we need to protect as many people in the population as possible, and we need to focus on the people who are most likely to die or be hospitalized. And our healthcare workers are incredibly important. They are at less risk of hospitalization and death compared to people over 80, over 70, over 60. So we still have to protect the older adults as a priority, and this is what the province is indicating. We are doing healthcare worker immunization at the same time as older adults to try to protect both populations. At this point, the provincial recommendation around an extended interval for the second dose is in place. And the only exceptions are for people who have very significant health conditions that decrease their immunity. So transplant recipients and people who are under active treatment for cancer. So at this point, I do not see a move to provide a second dose with a shorter interval to healthcare workers. I see the need to protect as many people as possible and focusing on the older adults.
Okay, can I ask you, this might be for Stéphane Roux. I know you probably answered this partly in French, but part of this story about the outbreaks at hospitals, of course, has to do with capacity. And province-wide, I know our critical care capacity is now at an all-time high with COVID patients. I wanted to learn more about the situation in Ottawa right now in hospitals.
Yes, you're right. The critical care capacity right now in the Ottawa area is pretty full at this time. We are working closely together, all the hospitals right now, to make sure we're able to take on the extra patients that might have to need that level of care at this time. So, and we're using different strategies in the hospitals to try to increase the staffing level temporarily, to be able to sustain that high demand. But that's a fragile situation at this time, and that's why we're all here today, this afternoon, to be able to try to control that raise that is worrisome for us. So we're going to have to adjust the staffing, provide more staffing to the ICUs that are full at this time. And we're confident that working together, we're going to be able to make it work.
So just to clarify that, the hospitals are working together to make sure there's adequate staffing?
Exactly. We have regular meetings at the intensive care units levels, as well as the CEO and chief of staff's level, and we're discussing capabilities and different options to be able to support each and every one of us. So if a hospital, for example, is reaching capacity, we redirect the other patients to the other hospitals. We may even consider sharing personnel at times, but mainly redirect patients. So we have plans in place at this time to be able to transfer patients from one hospital to the other at a more regular pace than what we used to for that specific reason.
Thanks very much.
Thank you, Liz. Our next question will be from the Ottawa Citizen, Bruce Deichman. Please go ahead.
Hi, Dr. Etches, and I think you've answered much of my question in French, but if you could do it again in English, please. You're urging residents to exercise more restraint, and I'm wondering exactly what you've recommended to the province. I know the Premier has said that there'll be an announcement tomorrow, and so what level of restriction are you suggesting we go into?
What I asked the Chief Medical Officer of Health to do is move us into the gray level. And that has been modified recently. So we know that there'll be many questions about what's allowed and not allowed in gray. So I certainly can appreciate that. I could spend a bit of time talking to you about that, but what it does is it takes away the indoor dining and it decreases the gathering limits for certain types of events. Certainly, inside is the most important, and we see that it requires people not to have people in their household that they don't live with. Unless they're a single person, they need the support of one other household, or they are essential support person for that household. Outdoors as well, and different kinds of physical activity are limited in terms of the size of gathering. There are more restrictions on the capacity in retail and hair and nail salons. So those measures on the business side are one thing. I really, in my comments today, was ultimately, if each of us can create more distance between the people that we come into contact with, so it's 2 meters at a minimum. We know the virus is more transmissible, and sometimes we've been letting our guard down around visiting or socializing, playing sports together outside, and this isn't the time to taking those kinds of risks anymore when we see the levels rising so much. We need to do all we can to turn this around until we see the vaccines providing the protection that we foresee, in not too long. But right now, your question, those are the kinds of measures, and also on the personal side.
Okay, and as a follow, at Christmas, when we went into the gray zone, there was some criticism over the timing of that essentially it was sort of a nod and a wink, and it's like, yeah, go get your shopping done, have your dinner with your family, and then we'll shut things down. So are you suggesting that we do this sooner?
Act before the long weekend. That's correct. I did ask that this happen before the long weekend. I know that businesses obviously can be affected if they don't get a lot of notice. So I have been working with the Ottawa Board of Trade and the Business Improvement Association lead to try to help spread the word that this is a possibility. The decision is provincial in the end, but I want businesses to be prepared for gray measures coming into effect possibly for the weekend.
Thank you.
Thank you, Bruce. La prochaine question sera pour du journal Le Droit. Julien Paquette, c'est à vous.
Bonjour. Docteur Roux, je vais en profiter pendant qu'on vous a ici aujourd'hui avec nous. J'aimerais savoir, peut-être de façon un peu plus concrète, vous avez dit que la capacité est pas mal maximale pour ce qui est des soins intensifs, mais cette pression-là qui est créée par une hausse des cas de COVID, avec des symptômes graves, quel impact ça a concrètement sur l'ensemble des services à l'hôpital Montfort?
Oui, l'impact actuellement, c'est que les gens sont fatigués. On est capable de maintenir les services actuellement. Là, les services sont donnés à 100%. Il n'y a pas de réduction encore. Par contre, on a des plans au cas où l'augmentation finirait par déborder un peu notre capacité. On a des plans avec la région pour faire, comme je le disais un petit peu plus tôt, transférer certains patients potentiellement ou ne pas accepter autant de transferts d'hôpitaux régionaux comme on le fait habituellement. Ça, c'est une des options qu'on a qui présentement est la privilégiée actuellement parce que ça nous permet de continuer les opérations dans tous les autres secteurs de l'hôpital. Par contre, si on devient au niveau régional à capacité, donc, on va devoir possiblement rediriger du personnel aux soins intensifs qui sont qualifiés. On a des infirmières, des infirmiers, du personnel de transport, par contre, qui peuvent aller aider les soins intensifs, mais ça va vouloir dire qu'on va devoir réduire certains autres services plus électifs, moins urgents. Notre priorité actuellement, c'est de maintenir nos services pour tous les cas urgents. Donc, on priorise comme on le fait tout le temps. C'est-à-dire, si c'est un cas urgent, c'est ces cas-là qui passent en avant. C'est tout basé sur les évaluations cliniques. Mais ultimement, ce qui pourrait arriver dans les prochaines semaines, là où on ne veut pas aller, ce serait de réduire les procédures électives, par exemple, parce qu'on a besoin de ce personnel-là qui est aussi qualifié pour s'occuper des soins intensifs, d'aller aider aux soins intensifs ou dans les secteurs qui sont les plus critiques. faut comprendre que non seulement l'augmentation des patients qui peuvent survenir à l'hôpital est une menace pour nous en ce sens de dépasser notre capacité, mais il y a aussi l'impact de la COVID dans la communauté qui nous prive de personnel hautement qualifié parfois parce qu'il y a eu un contact dans la communauté ou un enfant ou quelqu'un de la famille qui doit s'isoler et c'est toute la famille qui doit s'isoler. Donc, l'impact se fait sentir aussi à même notre propre personnel et c'est ça qui est le plus gros défi actuellement. On ne peut pas recruter en dedans d'une semaine du personnel supplémentaire. Tout le monde est à capacité dans la région, comme vous le savez.
Puis, en suivi à ça, j'aimerais vous entendre peut-être donner des exemples de ce que vous avez parlé de procédure élective pour la majorité de nos lecteurs, des auditeurs. Je ne sais pas à quel point ils savent ce que ça représente. Est-ce qu'il y a des exemples de ce que ce type de procédure-là peuvent être que vous pouvez nous donner? Je ne sais pas, est-ce que c'est des chirurgies, par exemple, pour un cancer, quelqu'un qui est atteint d'un cancer, chirurgie prévue, par exemple. Est-ce que...
C'est ça. Oui, je comprends votre question. Tous les cancers vont être vus par ordre de priorité. Des chirurgies électives, c'est surtout du dépistage, par exemple, des gastroscopies, des colonoscopies, par exemple, qui sont pour faire un dépistage ou qui sont juste sans facteur de risque majeur. C'est ces procédures-là qui peuvent être retardées. Des procédures qui affectent la qualité de vie, mais qui ne menacent pas la vie. On parle souvent de nos collègues orthopédistes qui ont beaucoup de procédures, ils ont beaucoup de retard dans leurs procédures parce qu'ils sont souvent les premiers, les gens qui attendent des chirurgies orthopédiques, par contre, sont souvent les premiers à être tassés parce que ça ne menace pas la vie. Par contre, ça handicape grandement leur qualité de vie de ces patients-là. Donc, ça peut être des exemples au niveau orthopédique, les cataractes, des choses comme ça. Qu'on ne veut pas ralentir parce qu'on a déjà pris des retards dans ces disciplines-là. Mais ça pourrait être le genre de procédure qui pourrait malheureusement être retardée si on devait rediriger du personnel spécialisé vers d'autres secteurs.
Parfait, merci beaucoup.
Merci, Julien. The next question will be global news. Please go ahead, Craig Lord.
Thank you. Dr. Etches, you talked a little bit about how events like barbecues and anywhere where people are outdoors but not keeping that physical distance are where transmission is occurring, very high risk settings. But even in the gray area, we see that 10 people gatherings are allowed, and at weddings or other religious ceremonies, you could have up to 50 people in an outdoor area. So do you think the restrictions as they're laid out in Ontario's gray zone are enough to curb the spread in Ottawa?
They may not be, and that's why I'm asking people to do their part. That is most under our control. And so the idea of what is permissible is one thing, but what is desirable, what will protect each other, what will protect yourself from these asymptomatic transmissions that occur with the variants. You know, it really is the basics of keeping distance between people who don't live with you, and using a mask to add that barrier. These are things that in the end, you can try to make regulations, but it really is about individuals understanding it's worthwhile continuing these practices because we will get there. We will get to better protection from vaccines, and there's too much damage to be done if we let COVID run wild before then. We need to continue to protect against outbreaks, protect our healthcare system, protect against transmission in schools and workplaces. We know there is a toll from the measures. We absolutely know the isolation and the challenge from not being able to connect. So I want to encourage people, do use that option of outdoor check-ins with your neighbors. Just make sure that we are using that distance.
Great, and I don't want to put you on the spot, but as you talk about the value of some outdoor gatherings, can you give us a sense of what that should actually look like? We see a lot of people maybe in their driveways in kind of a circle with lawn chairs, that kind of stuff, or people going for a walk. Can you talk about what might be better ways to spend time outdoors versus more high risk?
Well, yes, being very careful about the 2 meters. So if you think about going for a walk side by side on a sidewalk that's narrow, that's probably not 2 meters. So then adding in a mask where you're not going to have that distance, right? Choosing that setup where you put your chairs 2 meters apart over something like a soccer game where you're going to be coming into close contact with each other and breathing more heavily, in each other's spaces. So it is about choosing the lower risk ways to connect.
Thanks very much.
Thank you, Craig. Our next question will come from CTV Ottawa. Ted Raymond, please go ahead.
Hi, Dr. Etches. My question to start, just about going into the gray zone, is about some of the toll that you've mentioned before, people being tired of this. You've been saying the same message basically for the past year about distance and masks, and at what point do you think that more is required of individuals? Because we've all heard this, we all know this. What else needs to be done to limit transmission?
Well, we have seen what's worked in other countries. Once the variant of concern is widespread and, in this context where people are tired, it's been harder lockdowns, and where we have something more like the stay-at-home order. And that just takes away a little bit more of the choice from people. That is one of the things that may happen if COVID levels continue to rise. We also know that earlier intervention, the better, in terms of avoiding stricter measures and avoiding longer duration of measures. So looking at how quickly the variant of concerns are taking over in the wastewater, I can tell you almost every day matters. Every day that we see that exponential rise, doubling and then doubling and then doubling again, it matters, what happens quickly. I think the other thing that's different, the situation is different now compared to, I've said this for a year. I definitely have said these kinds of things for a year, that we need to distance and wear masks, but it's different. Our context is different right now in a couple of ways. One is how very stretched our healthcare system is with trying to not only provide procedures, care for COVID patients, do testing to extremely high levels again, vaccinate people. Our contact tracing team has lost members to the vaccination initiative, which is most important because that will prevent transmission. Vaccination programs will prevent transmission. Contact tracing is trying to catch up, and it won't turn the curve. We have also the variants of concern. So it's different now, where we see they are leading to transmission in kinds of settings that we hadn't seen before with outdoor sports. And we have an end in sight, right? We hadn't an end in sight for many months, where I was asking people to wear masks and do distancing, but now we can see that the vaccine will come and will protect our population to a much greater degree. And that also, I hope, can give people enough encouragement to hang on a little bit longer.
All right, I appreciate that. Thank you. And as a follow-up, I guess just on that subject, you were saying earlier that the gray zone as it's written may not be enough. Are you prepared for the possibility of any class orders at your level to impose even further or stricter restrictions? And if so, how soon are you thinking of doing something like that?
We are thinking about how can we help people get the message that they should really only be gathering with people outside of their household with distance. right now. We're thinking, how do we convey that in a stronger way? That when you're going to choose a socializing or a sports and recreation activity, at this point, it should only be with your household. We know there are also provincial discussions underway. And so I'm interested in seeing what the provincial discussions lead to. I'm interested in seeing exactly what the province decides about Ottawa. And when I see what these measures are, I will take a look again at those gaps that may exist and whether anything local needs to be done.
Thank you.
Thank you, Ted. Our next question will come from City News Ottawa, Eric O'Brien. Please go ahead. Eric, if you're speaking, you're still muted.
Thank you. All right. Yeah, I'm here now. Yeah, sorry, I think I missed a large portion of this meeting. So maybe Dr. Etches, I'll just ask you this question instead. How alarming is it for you to see that the cases are rising at such a rapid rate and not being able to do contact tracing in the city?
I'm disappointed that we've reached this point. Ottawa Public Health, unlike some other health units, has been able to maintain contact tracing through a number of surges. What we see now is, again, there's pressure. Our team is not as large, with some folks needing to support the vaccination efforts. The provincial workforce that we draw on as well is limited, as they are seeing people end up moving to work on vaccination. So there's just this limited number of healthcare workers that we're facing. What I know about contact tracing, though, is that it is not the solution to turn the curve. So people talk about the test and the trace system. It's an important system to understand if with the testing, does somebody have COVID and can we treat them properly and support them and make sure they're isolated and follow up with their contacts. That all happens after someone's infected. What needs to happen to turn the curve again is we need to prevent infections. So there's only two ways to do that. One is by increasing vaccination and providing immunity, protection against infection. We're limited in the quantity of vaccine we have. We'll use it as soon as it comes. But the other is our behaviors, and those are in our control. The distance between each other, being more careful, I know this carefuler is not a word, about the 2 meters, and the wearing masks and the hand washing and the staying home when you're sick. So contact tracing is something we are not going to abandon. We are modifying to focus on the areas where the risk is higher. So we are continuing to have a conversation with every person who tests positive for COVID-19 to find out what their situation is. Do they need help to isolate? Are they in a situation that could touch upon a higher risk population, like a school or a healthcare setting or somewhere where there are vulnerable people, or a workplace? And then what we are asking people to do, if it's not a setting where there are more vulnerable people, is to notify their own contacts. We're providing them with tools to do that. And we are providing workplaces with information and letters that they can use within their own workplace to notify employees if needed. So we are having to scale back on some of the direct follow-up of contacts. We will return to full contact tracing as soon as we can.
Maybe as a follow-up, and I'm sorry if one of my colleagues from other news already asked the question. You mentioned something about asking the province to go back into gray zone. Could that be done before the weekend?
Yes, that is possible. My request was to move before the weekend. We have consistently seen with holiday weekends that they're followed with a bump up in the number of people testing positive. So after Canada Day, Labor Day, Thanksgiving, the December holidays, Family Day, we can see that it's not useful to go into the long weekend without greater protections. And so that was my request to the province, and I'm hoping that they will move quickly.
Thank you very much.
Thank you, Eric. Our next question will be from CBC Ottawa. Kimberly Molina, please go ahead.
Hi, thank you for taking my question. Most people have asked my question sort of already, but I wanted to address going into gray. You sort of mentioned about the restrictions possibly not being strong enough and wanting to implement new or sort of local restrictions. But in terms of schools, would you support school closures at that time if the city did go into lockdown? I know in past you've sort of been opposed to that, but you've seen the numbers rising and outbreaks at various schools across the city. So I'm wondering if you've changed your mind on that.
I am not advocating for schools to close. No, I have not made any comments or requests to the province about school closures. I know that if we can bring the COVID levels down in the community, that is essential for schools to manage. So this level of COVID is difficult for schools. We have significant numbers of school-age children testing positive for COVID. And I might ask Dr. Sampson if she wants to add anything, given she is the chief of staff at CHEO. But we know that schools are an essential support to children and families. Without schools as a support, many families don't even know what they'll do right now to cope because they've used all their vacation. They can't stay home and be unpaid and still pay their rent. Like, there are real struggles out there with the closure of schools and the impact on families. So it's not something I'm looking to advance at this point. Dr. Sampson?
Thanks very much, Dr. Etches. Yes, I just want to emphasize that schools remaining open are key to the overall health and well-being of our children and youth. And so when this amount of COVID activity is in the community and we see that and get worried about that, that's why we want to ask, if not plead, with the public to do everything possible that they can to follow all the public health restrictions each and every time in every place that they are, so that we can get this surge of activity under control and ensure that our children and youth can continue to go to school. And you know, the impact of the school closures on the overall well-being of children and youth and families in our community has been huge, and we really want to avoid that from happening. So schools should be the last things to close and the first to open. And really, we're just pleading with everyone to follow all the public health guidelines and ensure that we can get this COVID activity under control so that our children, youth, families, and the entire community can continue to get through this.
Thank you. And I wanted to ask about hospitalizations. You know, we're seeing on the OPH dashboard that there are younger age groups that are being hospitalized. What are you guys seeing in terms of these younger people who are being hospitalized, and how might the variants of concern play into those rates going forward?
Maybe I can start. It's Dr. Sampson here. You know, here at CHEO now, as in most of the hospitals in the city, we are close to, if not over 100% capacity, and that's we're seeing a huge surge in activity of COVID infections across the city. That has us very worried. We are also very worried given that the variants of concern are now playing such an important are such a high proportion of the number of new infections that we're seeing. And we do know that it is impacting younger people differently. As Dr. Etches sadly reported, we had a very young adult pass away over this past week. And we know that it's also they contribute to increasing activity overall in the city. So we're watching this very, very closely. Right now, we are able to maintain all expected activity. As Dr. Roux mentioned, we are having to plan in case that's not the case, and monitor the variants of concern very closely as they play out. We're still learning about what is different about the variants of concern, but we know that the infection is transmitted very easily and impacts different portions of the population than the initial COVID infection. And we are concerned that younger people are going to become sicker if this progresses.
Nous tenons sincèrement à remercier Dr. Roux et Dr. Sampson pour s'être rejoints à nous aujourd'hui. A very sincere thank you to hospital partners and representatives Dr. Roux and Dr. Sampson for joining our availability today. That is all the time we have. As always, thank you to our media partners and enjoy the rest of your day. Happy Wednesday, all.
Merci, thank you.